Very much. Sujit.
Please make Dr. Ashrafur Rahman the co-host so that the doctor will be able to manage.
Okay. Hello, Mr. Sujit.
Yes, yes.
Okay, thank you very much. Good evening to all the respected audience. I am very honored today to extend my greetings to all who are present here for this wonderful program for the 200-day celebrations of daily Zoom meeting by International Forum for Promoting Homeopathy with 48 hours Zoomation. Now I am declaring the program from Bangladesh to start. I am handing over the floor to Dr. Samina. She has done her Bachelor of Pharmacy, followed by Masters in Pharmacy and MBA, also DHMS PDT. She is the Vice President of Federal Homeopathic Medical College and Hospital, Dhaka, Bangladesh, working as the Vice President, World Federation of Homeopathy, Bangladesh Chapter, and Bangladesh Human Rights Commission of Greater Mirpur, Dhaka. Secretary, Publication of Homeopathy, Darpan Magazine. From now on, she will be conducting the program as an MC. Please, Dr. Samina. Please, Dr. Samina Arif.
Yes, sir. Thank you, sir. Our first speaker, Dr. M.A. Jahangir, and I would love to say a few words on him. Dr. M. Jahangir is the chairman of Ideal and Science Lab in Bangladesh and ex-principal of Sharupkathi Homeopathic Medical College and Hospital. His educational qualification is BHMS, MPhil, and PhD. He is also an author of Homeopathic Treatment Procedure. He acts as a scientist, and moreover, he is a great asset and resource for the homeopathic world and the society. Please, sir, give your presentation in front of us. Sir, please. M.A. Jahangir, sir.
Please, Dr. Jahangir, your video and audio clear.
Sir, can please raise your hand so that we can identify to unmute you? Okay, just no. Oh, you have to unmute in the participant list. Go to the participant list and unmute from. Raise your hand so that it will appear in the beginning, so it is easy for us to identify you.
Thank you.
Dr. Jahangir, M. Jahangir, continue.
Just a minute. Just a minute. Unmuted. Okay. Okay. Thank you.
Better. Good evening, everyone. I am Dr. Jahangir, Chairman Ideal Research and Science Lab, Dhaka, Bangladesh. I am very much glad to meet you all, especially IFPH family of the world. Today is the special day for Bangladesh of IFPH. So my salute to Dr. Ashrafur Rahman and anchor Dr. Samina Arif. Dr. Samina Arif asked me to talk about heart disease, which cured by homeopathy. I think it is very important for the time. As we know, in Bangladesh, last year, 1,80,408 patients died with heart attack. In second position, the brain stroke. In brain stroke, 85,360 patients died. But only 8,248 patients died with COVID-19. As we know, world most critical disease is the heart disease. And then comes diabetes, then cancer. First is heart disease. We have to think about heart disease, all heart diseases which we can cure, that allopathies cannot do so much except operation. I am presenting mitral valve stenosis, which allopathics only treat them on surgical media. But in homeopathy, stenosis is a curable disease. Rheumatic heart disease, as you know, rheumatic heart disease, heart valve can be destroyed in many formats. As we know, you see there is normal mitral valve on the left side, and on the right side, this is mitral valve stenosis is there. Their blood is coming very little from the valve. Because of the mitral valve cannot close properly. Then patient ultimately takes carbon dioxide blood in his body, in brains, except oxygenated blood. Mitral valve stenosis is a chronic rheumatic heart disease. You know, it comes from after effect of acute rheumatic fever. Many times it comes with a acute rheumatic fever. There are many diseases. Rheumatic heart disease cause heart failure, sometimes arthritis, stroke, endocarditis, etc. By this, suddenly patient died with these diseases. Rheumatic heart disease is damage of the heart valve. That called mitral valve can be damaged with this disease, mitral stenosis. In a stenosis form, valve cannot work properly. Then patient died with this disease. In this picture, you can see that mitral valve cannot prolapse. Is prolapse, it cannot fold, it cannot go properly to this original form. But in normal valve, it is also closed, properly closed in left side. I have a patient. I want to talk about a patient which I have treated in my chamber. This is his ultrasonogram. There you see there is a narrowing spaces showing left ventricular and left atrium in the middle of left ventricular and left atrium. There are some case reports. There are some case reports. I think it is very far from it. I want to say some medicine, so I'm going so fast to this position. Valvular disease. I think I want to go more to the last position. This is the inner side of a mitral stenosis. You see, in the middle, on the border, whole borderline of the mitral valve is swollen, but the middle is slightly open. So always blood is dropping from this mouth. My patient name is Monowara Begum, 49 years old. As we is constitutional hydrogenoid, weight 88 kg. That is, she was very bulky. Patient was doctor disagrees to operate his mitral valve because with weight and health condition. A chief complaints are shortness of breath, especially while walking, chest pain, discomfort, dyspnea on climbing stairs, sneeze pain with swelling, eruption of skin, fever or chilliness due to fan air. I think these are important for homeopathic prescription. He has cough during sleep and relieved by expectoration. Using water, he's aggravating using water. This is his cold affected, burning on head and feet. Past history, she has the past story for a long time, 10 years of time, he was suffering with chronic rheumatic. And childhood, he was suffering with rheumatic fever. I have treated him for a long time, 1 year and more, but from the beginning, I have found him moderate to severe mitral stenosis. It was October 211. On 213, it's come to moderate, from severe to moderate. And after in 215, it's also moderate, but in 200, I cannot say that, mild moderate in form. He come with this come with homeopathic medicine. These are his her echocardiogram report in many times from different hospitals. The patient started treatment with homeopathy from 215, 212. Like diagnosis on 29/11/218. After continuing treatment, treatment ended on 27/12/200. Echocardiogram report, which is I have already said before, that she was moderate to severe position of mitral valve. After treatment of homeopathy, she came to mild to moderate stenosis, and he was so much good to walk or doing her daily works. The changes which I found in different time, that she had edema at 12, 2012, dyspnea is reduces, cough reduces. At 12 at 12, she had no edema. Chewing pain, extremities, pain in extremities, temperature reduced. And 214, the chest pain, but anxiety in chest, no dyspnea, no cyanosis. BP 215, I found is BP 138. That was very good for her a heart disease. In 2016, first notice he has no problem except palpitation. Palpitation with dyspnea, sudden chest pain and dyspnea. No dyspnea, only palpitation. Chewing pain in extremities. Slight palpitation on 2018, chewing pain in extremities. Pimples in extremities with pruritus. Treatment. As a chronic disease, and whereas the morphological change is present, I have treated with him with Moderinum 10m, 1 dose. Then I collect the totality of the symptom of the disease. Then it comes to nausea, tripodians. I have given her nausea 200, and sometimes I have to give her Lilium tiglium 2000. And as she has edema, sometimes I have to give her oxalic acid 2000. And in a drainage of the heart, I have given her digitalis and sometimes Cretagas. At the last time, you have seen she had palpitations where I have given her digitalis and Cretagas on the pain in the chest or in the heart. I finished her remedy with Rastoxidantron with 10m because of he was suffering previously with rheumatic heart disease and rheumatic fever. So Rastoxidantron 10m, then 1 dose of 50m. In the meantime, sometimes I have given her sulfur, agaricus, Actius spicata, Advis vernalis. Madurinum, I have said before, as a psychotic patient, I have given Madurinum 1 dose in the initially of the treatment. On totality of the symptom, as I said before, that the nausea, tripodians is the main medicine for her to treat the mitral valve stenosis. Mitral valve stenosis, as a valvular, it acts on heart and valvular troubles. In nausea, we have seen blood surge to upward, makes dyspnea, inability to lie. Patients cannot lie on bed, especially on left side. Hypertrophy of the heart, valvular relation we have found in nausea, mainly damaged heart with infectious disease. That we have found that she was suffering with rheumatic heart disease. That is the infectious cause behind this heart problem. So nausea come perfect position to treat the patient. Lilium tick also I have given sometimes where symptoms agree with the patient. That is rheumatoid arthritis is one of the main symptoms for the Lilium tick, and also pain in cardiac region. It is also come on Lilium tick, where feeling load on the chest or heart side, patient feels a load. This come to Lilium tiglium. Sometimes this patient called me, I have feel some pain Also, nausea has the pain, but here is a chest uh, load filling, palpitation. These are the main symptom of Lilium tickler. And another thing of Lilium tickler is suffocation feeling. In warm room and crowded, where people are many in the room or in the area, he feels suffocation. He feels better in alone and cold temperature. Adonis were also a valuable medicine for the heart disease also. It acts after rheumatism. As we know, the patient is suffering with rheumatic heart disease. Adonis were also come better in a heart disease for the rheumatic position. Muscle heart, here we think that we can see that muscle of the heart, uh, fat degeneration on heart can cure with Adonis vernalis. As we know, I have said before, the patient was bulky. She had 88 kg weight, more weight, and he had fat degeneration in his heart. So Adonis works better on her heart problem, especially where is hypertrophy of the heart is present with cardiac stenosis, mitral regurgitation. In both cases, stenosis and regurgitation, both cases Adonis var is the better for heart disease. Then another thing we can see in Adonis var with the uh, irregular pulse, where we can see the irregular pulse, where sometimes it below 72, sometimes it rises up to 120. Then we can, if we give them Adonis var, it will be controlled to on normal position. And give a power, give a strength. Adonis var give a strength to the heart disease, any heart disease, and give a strength to the heart. Oxalic acid is not frequently usable medicine for the heart disease, but it is very good where the calcification of the heart. In case of calcification, and where in the body, in anywhere in the body, the oxalic acid comes better to cure the calcification or sclerosis in heart, in heart, in artery, in kidney, everywhere where the sclerosis or calcification present, oxalic acid works better. The sulfur, as we know, sulfur is the king of the sora. And where is the soric complaint? We can give the sulfur first. But where is the psychotic patient has a heart disease, we can give the sulfur at the end of the treatment. That it creates the soric complaints. It diminishes the soric complaint of the heart patient. That some sulfur had also some heart problems. These are valve operation. You see, oppressed filling due to affinity of heart muscle and valves. Patient fails operations, and a load of chest, as we have found in the Adonis var. Also, sulfur had the load of chest. Many patients we know, the many patient of the heart feels load on chest or compressed of chest, compressed with heavy stitches. These are the main complaints of the heart, as it is said that. But sulfur acts. I think it acts better at the end of the treatment. Digital is one is the best remedy. It is one of the best remedy for the heart, where palpitation is abnormal or more palpitation you feel in the patient, but the pulse is weak. Palpitation is more, but pulse is weak, and this is also a rheumatic subsequent feeling of rheumatic heart disease, rheumatic fever. Keratagas is also a good remedy for the heart disease. It is said to be heart tonic for the heart muscle. Chronic heart is extreme weakness, where we see the heart disease patient feels extreme weakness. Then this is the patient. This patient we can give the patient the Keratagas. And also, patient, we found the patient irregular heart action. Heart action is very, sometimes it's more palpitation, sometimes it's not, sometimes feels pain in chest, sometimes not, due to myocarditis, endocarditis, etc. For etc., we can see the pain. Sometimes we feel in, sometimes go. So when we see the sometimes patient feels pain, sometimes not. This is Keratagas. We have to think that Keratagas is the main remedy for this patient. And also, you see arterial tension. There is arterial tension is high. That means blood flow comes more in the arterial tension. Also, Keratagas creates the arteriosclerosis, where the sclerosis we found in arteries. Arteries become harder, become excused. In this position, Keratagas is better to keep her or the patient. On the side of we know oxalic acid, this is also oxalic acid treated the arteriosclerosis and calcification. Here is also Keratagas also give the same solution for the arteriosclerosis. Rastox is we know Rastox is a poison, plant poison, but it is also work on heart, basically where the rheumatic heart it cures the rheumatic hearts or rheumatism on the heart or fibrous tissue or heart pain due to rheumatism, or patient feels heart pain also in the chest pain and back pain. Various pain comes with heart disease, that is Rastox. And when we see the rheumatic fever is the origin of the disease, or typhoid fever is the origin of this heart disease, Rastox will come earlier or in the middle time of the treatment. Yeah, this is another approach by which I do agree to treat the patients. That is, first inflammation of an infection appears on the body, that we see the rheumatic fever or rheumatic heart disease appears first. The secondly, functional changes happened in the disease area, that is in the heart. Functional changes, we found the functional changes happened. Lastly, morphological took place. This is the research. It's a research gap in our system or any system. We go through the disease cause, but we do not take the patient's changes where it is goes wrong. That is we say psora, syphilis, psychosis. This also come to the psychotic patient or syphilitic patient is ulcerative or change where morphological change arrange. This is the final morphological change arrange. But psychotic disease is functional changes. And inflammation and infection are the primary changes that we can say sora in the beginning. Sora is start with the disease. And here in this position, we treat the infection of the disease first. Then we go to recover the functional changes. Finally, we go to treat the morphological recovery. Finally, complete recovery step with we have given finally Rastox, then sulfur 1 dose. These are the final symptoms because of patient may affect again with this heart disease or rheumatic disease. Oh, there are some other medicines in grading in William Boric, but I have chosen these few medicines. That way I have said before. Their first grade medicine, 12 medicines, but I have chosen only 2 or 3 medicines. And grade 2, there are some other medicines. In them, I have chosen oxalic acid, Rastox from 2nd grade medicine. There is a Kant philosophy that we have to take 5 medicines from all the taken symptoms medicine. Then we read these 5 medicine and go to the patient symptom, which is effective for the patient. Yes, I have it said it before. Thank you for patient sharing. All of you, thanks for my lecture. Finally, I would like to thank to organizers of IFPH, especially Dr. Shaji Kudiat, for a nice program and making the idea of IFPH. Thank you all. We're listening in IFPH.
Thank you, sir,
Thank you.
for your nice presentation. Thank you, sir, for your nice presentation. May I introduce our next speaker, Dr. M. Asharul Haq. He is a MCom, LLB, PGD, PM, and DHMS. He is working as a senior teacher for 25 years at Bangladesh Homeopathic Medical College and Hospital. He is the chief practitioner and owner of Life Care Homeopathic Center on magazine. He has been awarded nationally and internationally as a homeopathic practitioner. Sir, please share your experience with us.
Can you please raise your hand to identify you, please? Please unmute from your side, sir. You can unmute from your side.
Dr. Asharul Haq, please unmute. Unmute the computer. Yeah, right. Okay.
Yeah. Thank you, sir. Are you hearing?
Yes.
Yeah.
Yes, please. Thank you very much. Dear sir, this is Dr. A. Masharul Haq from Bangladesh. Pay my respect to Mr. President, Vice President, Secretary, Joint Secretary, and other big shots of IFPH, including distinguished guests and our country chief, Professor Dr. Ashafur Rahman, and the excellent announcer of this session, Dr. Samina Arif, Vice Principal of Federal Homeopathy College, Dhaka. Please, I welcome from Bangladesh or the people of Bangladesh and on my behalf of all of you from Bangladesh. Thank you, sir. I am ready to present a paper that is homeopathic treatment of frozen shoulder with a case reference. Now I can start, please. Nowadays, we see many patients come to our medical chambers for the treatment of various diseases of muscles. Frozen shoulder is a disease under this group. Mainly, this type of chronic disease arises from psychotic miasm, that is miasmatic, out of miasmatic causes. It is also called adhesive capsulitis and periarthritis. There is a great achievement of homeopathic treatment in muscles pain as well as frozen shoulder. What is actually frozen shoulder? I am going there. It is a disorder of which the shoulder capsule, the connective tissue surrounding the shoulder joint, that is glenohumeral joint, becomes inflamed and stiff, greatly restricting movement and grows chronic pain. Sometimes medically referred to as adhesive capsulitis or periarthritis. Women are more often affected than men. Usually, frozen shoulder affects one side, left or right. It may go on to develop it on other side. However, joint symptoms. As other muscle disorder, frozen shoulder has some common symptoms, that is dull and violent pains aggravated by every attempt of movement. In frozen shoulder, especially, it restricts severely the movement of the shoulder. Pain is usually constant, worse at night when the weather is colder. These conditions last for 5 months to 3 years or even more. It is thought that in some cases, the frozen shoulder caused by injury or trauma to the shoulder area. Frozen shoulder may also cause chronic inflammation. Adhesions grow between the joint and tissue, greatly restricting motion and causing a number of painful complications. There is also a lack of fluid in the joint, further restricting movement. Please, let us discuss about its etiology. Exact cause not yet been known. Even then, there may be autoimmune etiology, history of trauma to the joint may be present, hyperthyroidism, diabetes, heart diseases, a fracture of arm injury, shoulder injury, cervical disc diseases, degenerative arthritis, surgery at shoulder, and the miasmatic cause, especially psychotic miasm. Now, clinical features of frozen shoulder. Onset insidious, pain in shoulder, that is upper arm, severe aching pain, restricted shoulder movement, difficulties is routine activities, that is as combing hair, wearing shirts, use of hands at bathroom, etc. However, how to investigate for identification of the disease? Here, X-ray reports nothing shows. Therefore, through X-ray, we cannot identify the real cause or real position of the shoulder, or frozen shoulder. Diagnosis of frozen shoulder can be done by physical examination and clinically. What may be the general management of frozen shoulder? Now I can discuss, please. Rest of joint during the acute stage, provide sealing. This is very effective. Mild passive shoulder exercise, compress by hot water bag, sometimes cold compress. Procedure for homeopathic treatment for frozen shoulder. Homeopathy treats the patient as a whole, means not treating partially, but as a whole, as a person. We know that the homeopathic medicines are selected after full individualizing examinations and case analysis, which include the medical history of the patient, physical and mental condition also. A miasmatic tendency is also taken into account in treating the chronic condition. The medicines mentioned here indicate the therapeutic affinity, but this is not a complete and definite guide to treat. The medicinal symptom is not directly related to this disease because the patient's individuality is necessary. Therefore, it's a mere guideline. Now, I can mention some remedies of homeopathy for the frozen shoulder. Please note that every medicine has a long discussion of its symptoms, but due to shortage of time, I may only mention the names and a little bit of symptoms of those medicines. Calcarea phosphorica, rheumatic pains in shoulder and arm, also with swelling of the diseased part and febrile heat, ulcerative pain, especially in roots, fingers, nails of right hand and in middle finger. Then Ferrum metallicum, shooting and tearings in the joint of the shoulder and in the arm, or pullings or paralytic weakness and heaviness, cracking in the shoulder joint, nightly tearing and stinging in the arms. Then Ferrum phosphoricum, violent drawing, tearing pain, right shoulder and upper arm, worse violent motion of arm, better gentle motion, so that patient hardly kept it still at all, somewhat sensitive dampness, some city deadness in right hand. Bryonia alba, very common medicine. Severe pain made worse by slight motion, compelling the patient to keep still. Application of heat also worsen the pain. Absolute rest, gentle massage, and lying on the affected shoulder help to relieve pain. Now, ras proxicodendron. Swelling, affinity, swelling, stiffness, and paralytic sensations in joints from sprains, overlifting, or overstressing, lameness, stiffness, and pain on first moving after rest, very common symptom to ras proxicodendron. And then no, on getting up the morning, it is worsened, better by constant motion. Chelidonium, pain in the right shoulder, spreading to right upper back, pain in oats from movement of the shoulder and on touching, but better from pressure, that is massage. Cyclina, frozen shoulder with stiffness and pain that spreads into the arm bone. Pain is especially troublesome during the night, preventing sleep. Ruta, cleansing pain in the shoulder joint, especially when permitting arms to hang down or when string on them. Shocks in arms as if in bones, dull retrains in bones of the arm and joints of elbow. Sanguinaria canadensis, rheumatic pain in right arm and shoulder, oats at night in bed, cannot raise arm, motion, turning in bed, mass oats, pain in top of right shoulder, pain in right shoulder, right deltoid. This is a very nutshell. Now again, magnesia carbonica I mentioned. In muscle rheumatism, it has a great effect, particularly on the right scapula, while the symptom is pain drops little bit and again comes with aggravation. Heat compression is very effective in this pain. Now I can go for a case reference in my chamber. This is the patient's name is S. Khatun. Profession is about 50. Profession administrative officer in an organization, Dhaka. First visit in my chamber, 5th of November 2018. Complaints. Very nutshell, I have written. Severe pain in right shoulder, particularly at joint of arm and shoulder for 2 weeks. She was clinically examined and observed that she was unable to raise her hand. She told that pain was worsened at night than the day. Her face was pale with full of anxiety. She was healthy and fair in complexion. She had a past medical history, that is, she suffers from chronic bronchial asthma for last 20 years. and she was under my treatment for 3 years. Now better than the past. The patient had a history of hysterectomy, uterus and ovaries both, done at Sir Salimullah Medical College and Hospital in Dhaka in the year of 1998, a mid-time or the July at that time. What medicines applied in my chamber on 5th of November 2018, just first dose were aconite nap M1 for 4 days. It is in the 50 millisiemen method. I applied medicines and result no progress. On 10th of November 2018, placebo applied and continued for 2 weeks, but even results are not responsive. On 25th of November 2018, there was a feeling of stiffness, soreness, and pain in the shoulder, which was worsened after rest, but gradually diminished on movement of shoulder. She felt better after applying dry heat. Medicine applied Ras Tox M1 up to 1st of December 2018. Result not satisfactory. On 2nd of December 2018, again case record was newly done and observed that her right-sided frozen shoulder was accompanied by burning in palms, that is on hands, and at soles. Pain was worsened from movement of the shoulder and better by rest and sleep. Then medicine applied Sanguinaria canadensis M1, result responsive. After 2 weeks, again applied M2 of the same medicine. Then after 2 weeks, M3 was applied. On 2019, or the 20th January of 2019, development was stagnant. Newly case history was considered and seen. Pain drops for the time being, but comes back with more pain. Patient wants heat compression, but heat in the bed was intolerable. Medicine applied Magnesia carbonica M2 for 2 weeks. Magnesia carbonica, the same medicine, M3 for 2 weeks, then M4 for another 2 weeks, and then M5 for another 2 weeks. Result, the patient is now quite okay. Constitutional medicine was applied at last. Finally, she was applied Calcarea carbonica, M2, M3, M4, M5, with a gap of 2 weeks in between, and continued for 5 months. Total curing time was 10 months. Conclusion is this: for better result, we must follow the instructions of Sir Dr. Samuel Hahnemann as laid down in aphorism 84 to 104 of the Organon of Medicine for Ideal Case Taking, and as per the book Chronic Diseases and its Peculiar Symptoms. Thank you very much. Sorry. for giving me the patience of hearing. Thank you, sir. Thank you very much. All these.
Please unmute from your side.
Hey, unmute. Okay.
Please, Dr. Samina, continue.
Thank you, sir. May I have the privilege to introduce Dr. Nazmul Hassan Jameson. He has achieved BHMS, MPhils, his skills in clinical research and experience in complementary and homeopathic medical medicine research. Dr. Nazmul is a gem in the homeopathy world of Bangladesh. Moreover, he is a scholar and a great physician in Bangladesh. Besides this, he is an excellent mentor of homeopathic doctors. Now I am requesting you to share your ideas regarding your topic. Please welcome, sir.
Thank you, Dr. Samina. Thank you, Dr. Samina, for your nice presentation and inviting me here. And I'm going to present my thoughts in a PowerPoint presentation. So, um, my today's topic is scope of case studies in homeopathy. And I would like to invite everyone, the most respected guests and honorable uh, chairman to these sessions, to my presentation. I'm Dr. Nazmul Hassan, and here my presentation is. I have only two slides, so you don't need to panic actually. What we see in our medical science, there are a lot of scopes in case studies, because case studies research is a highly flexible conception. Because during a case, a researcher or a physician can manipulate some medicines and laws that is prohibited in conventional practice. So if a physician experiences some extraordinary results from a medicine and from his treatment policy, he can express his views in the international arena with this case presentation. Then powerful research contributes to medicine researchers, which is very important, because when a case studies is presented, some other researchers, some other practitioners may have an evidence, may have some courage to use those ideas to his patients, or may experience or may manipulate his ideas to confirm his previous case studies. And confirmation of variety of applications, which is very important in medical science, because one medicine could be used in a variety of symptoms, and one medicine has ability to minimize a lot of symptoms, and also have uh, also have the scope of use or the to identify the application of that medicine in some other points which is not already which is not recorded, which is not evidenced before, and manifests a new rezoning of medication. If we see the medication, say, if I give you an example, we were using paracetamol, the ibuprofen for some pain relieving as a pain relieving medicine, but nowadays we also offer this medicine in some sort of anxiety relieving cases. So modern science are using the ideas of case studies in daily practices. And in homeopathy, we have also noticed that case studies are very important. If we see the trend of adding rubrics related to complaints are ahead, because if we see the complete repertory, lot of new rubrics are added with the clinical evidences, and rubrics added not only in generalities but also in different chapters, because if we see the synthesis repertories, there is a chapter generalities and the sub-rubrics. We find there are sub-rubrics. There is the laboratory findings, and a lot of medicines are added in this chapter in some laboratory findings on some laboratory findings. Clinical evidence confirms diversity of application of medication, which is very important in homeopathic medicine, because homeopathic medicine are still now we are using it evidence-based. We cannot say that we are confined that this medicine will work in these and these symptoms. We are experiencing that, okay, I had this result on this I had result these cases, then symptoms in our personal measure medica or in our personal diaries to that medicine that symptom should be considered if we get it in future, and may minimize many confrontation, which is very important in homeopathy, because homeopathy is facing a lot of confrontation and what should I say, that the negative thoughts and negative vibes from the international scientific arena. If we present the case studies in international journals, then a lot of new theory scientific arena, scientists will get encouraged to know the homeopathy, what is actually homeopathy and what actually homeopathy does, and what should be avoided in homeopathy, and what should be avoided uh, in approaching approaching homeopathy, and not should be, it should be like this, that well, I don't like homeopathy, I don't like homeopathy. It's not be like that. It has to be backed with some scientific evidence that homeopathy should be patronized by the mainstream scientists, and it has to be approved by the mainstream science. If we see the our scientific if we find it in our scientific arena, that not much case studies are there to back our evidence based homeopathy, as we demand that we homeopathy practice on our evidence basis. A lot of patients, a lot of doctors present their cases in the webinar, in the seminars, but none of them, not actually none of them, but most of them doctors are not presenting their cases in the scientific journals, which is very important in proving homeopathy in scientific arena. And we don't know that a single case study may encourage a full external research, which we find in uh, uh, Dr. Kudaworks from the sorry, I forgot the university name. He's India. He's from Kolkata. And Dr. Kuda Fox, he's a geologist. He's not even a homeopath actually, but he researches. He has more than 155 researches on homeopathy. This is very good, very good. But being homeopathic scientists like that, only Dr. Vitulkas and some other doctors from Mid-European countries and new doctors from Indian are trying to pull their strings. But what I think that all the homeopaths should emphasize their concentration on the case studies, and to publish in scientific journals that could concentrate the focus of a scientific arena into the homeopathic or into the homeopathic medical systems. So this is my thoughts for now, and I was told that I had to be very fast, so I went very fast. Thank you. And is there any questions, then I can answer. I cannot.
Thank you, sir. Now I want to invite Dr. Tufail Hussain to say something his speech. Dr. Tufail Hussain is achieved DHMS PG Home. He has a vast experience in homeopathic arena. Please give your valuable speech. Please, sir.
I can't get out my side. Yes.
Excuse me. Uh, please, Dr. Shujit, Dr. Kudiat,
Yes,
are you here?
yes.
Please
Okay.
unmute Dr. Shajib.
Okay, yeah. You can unmute from, unmuted. Yes.
Okay,
Yeah.
thank you. Thank you.
Okay.
Thank you, dear distinguished guest, my colleagues, Honorable Secretary, Vice President and President of IFPH. Assalamu alaikum and good evening. This is Dr. Tufail Hussain from Bangladesh. Before to starting my small presentation or sharing my experience, with great respect, I would like to remember Sir Dr. Hanneman and Dr. Kent, sir. As we just following their research and saying glorification on their works. My small topic and my sharings is homeopathic case taking and repertories with help of mind chapter. As you know, mind is the key to the man, and key chapter of homeopathic repertory is the mind. Patient, to find patient individualization, uh, we the unique symptom of mind is always help us to find patient individualization. In our chamber, what this common question to the mind is, this is in our practice, we ask patient how the quality of your sleep, do you get dreams, the emotion to do express day-to-day life, etc. In the different, this is the
Good evening, doctor.
hello.
Yes, continue. Please.
This is the traditional as we find mind chapter, this is the common question. My observation is present alter mental state. But what is present alter mental state? Present alter mental state of patient, as we know, an alternation of mental state refers to general change in mind for his current difficulties. For these current difficulties we may arise confusion, anger, unusual behaves, fear, change in emotion, which we see organon aphorism 18 210 to 230. In my observation, to find patient's individualization, present altered mental state is very important. This is my observation, and what the result I will getting in few of my cases and few my experience. I want to share a small case, a simple case from my clinic. The patient is female patient, 14 years old. She came to my clinic in 24 July 2019. Main complaint was tumor on forehead. After case taking, what I found, she didn't want to come Dr. Chamber. After some discussion, I find out because of injection fear, she didn't want to come. When she was asked by me to take an injection from my clinic, she take an attempt to quit my chamber. She cannot stay in dark at home, cannot stay at unknown place. Someone always need to stay with her, otherwise she feel depressed. I just observed, taken this from with talking with the patient and his relative, her relative. After taking the case, the rubric taken, first rubric taken, I taken, mind, fear, doctors. Fear injury, being injured. Of. Escape attempt to. Fear dark of. Company desire for. And last rubric was sadness, alone when. With that, all those rubric, the medicine comes stramonium. I given him her stramonium medicine on 24 July 2019. She came again my chamber 20 September 2019. I given her no medicine, but I found no change. After 1 month, she came to me again. I found no tumor. She came again my chamber on 14 February 2020, and I saw the tumor rising again. I take the case again, and medicine was the same, and I given him her next potency. After 4 months, she came to my chamber and found no tumor, and after test taking, I found she has no fear and no anxiety. She last came to my chamber 2020, 20th August, and she showed no complaint. After that, she didn't come to me. I asked just 1 month ago, I called her family and found no complaint again. This was my case. I just share with you guys. Thank you.
Is Dr. Samina?
Dr. Samina.
Oh, please, Dr. Samina, unmute your. Okay, so continue.
Yes, sir. Thank you, sir. Student life is always an evergreen part of human life. And this evergreen speaker is Abdullah Muhammad Jahin. His educational qualification is BA in English Linguistic from North-South University. He has completed DHMS and doing BHMS under Dhaka University. He is a studious and meritorious student who will be a shining star in homeopathy near future. Please say something about why you are interested in studying homeopathy. Thank you.
Please unmute.
I can't. Dr. Samina, thank you. Thank you for addressing me. Hello, I'm Abdullah Muhammad Zain, and I am currently studying BHMS, which is the Bachelor of Homeopathic Medicine and Surgery in Bangladesh. And I have completed my graduation from North South University. The thing that diverted me towards homeopathy is, in other treatments and stuff, there are, you need to go to the hospitals, and then the doctors have to check you, give the reports, what you have gone through and stuff. But in homeopathy, there is nothing like that. In homeopathy, there is only, the symptomatic treatments and stuff. Basically, because of this issue, I have drawn towards homeopathy because just say, think about this situation of COVID-19. Okay, this COVID-19 situation is so tough that the other treatments and stuff, such as think about allopathy, they are bamboozled because they have no clue what to do because of this COVID-19 situation. So the vaccines came, but this was so late for the whole world. But what is homeopathy doing? Homeopathy is basically treating the patients with their clues that what they're getting, their symptoms that they're getting, right? And because of that, I have gained some respect with homeopathy. And before that, I have some issues like I have a migraine pain. So the allopathic medicines are in Bangladesh, such as Napa, paracetamol, and stuff. So if you take these kind of medicines, your headaches will go within an hour or something. But what homeopathy does is, treats this kind of diseases so quickly that you cannot imagine that how well you will start to feel after within 10 or 15 minutes after taking those medicines. And growing up, I have a tumor kind of thing in my right leg. So growing up, my father has to take me to the hospital, and then there was a small operation in my right leg. But in homeopathic stuff, there is no need for operations or stuff. You can be cured with taking medicines only. So this is why I trust homeopathy, and which is why I have taken homeopathy uh, for further education, and I hope I will be continuing this and serve my country in homeopathic sector for the future. And thank you so much. That's all for me. Thank you so much.
Yes, Dr. Samina.
Thanks a lot for choosing the homeopathic sector, and wish you good luck. May I have to honor to introduce Dr. Muhammad Jahangir Alam. He is achieved BHMS, MPH, PGD, PG, Home, and now his professional achievements Register cum Secretary Bangladesh Homeopathy Board, and he is the chairman of Homeopathic Foundation Bangladesh and Bodrunnesa Latif Memorial Foundation, and also the Secretary General Shadhinata Homeopathic Chikisha Porishad, Organizing Secretary Kochua Upazila Shomiti, Dhaka, ex-VP Government Homeopathic Medical College Students Union. He is a dynamic registrar, a veteran administrator, a frontline doctor in recent COVID-19 cases, and a great leader. During the pandemic situation, he took all the homeopathic doctors in one platform and handled the COVID-19 pandemic. Welcome, sir.
Please, Dr. M.D. Jahangir Alam. Dr. Kudiyat, please unmute him.
Please unmute from your side, doctor. Please unmute from your side.
Dr. Jahangir Alam, please unmute your side. Please unmute your side.
Doctor need to unmute from his own side. We have given instruction to unmute, but the doctor need to unmute from his own side.
Okay, জাহাঙ্গীর ভাই আপনার আপনার ল্যাপটপ কিংবা মোবাইল থেকে আনমিউট করতে হবে। Yes, yes. Please continue.
আমাকে বলছেন?
Yeah, yes, yes.
Oh, yes. Program is started already?
Yeah, yeah. Already.
Dr. Ashraf, can I start my lecture
Yes,
or my
yes,
speech?
yes, yes. Yes, please.
Okay, thank you very much. Dr. Ashrafur Rahman and others dignitaries, especially Dr. Samina Arif and Dr. Abdullah, Dr. Hawk, and others dignitaries of local and abroad, all of my homeopaths and pioneers, and welcome to all of you. This is Dr. Jahangir Alam, Registrar cum Secretary, Bangladesh Homeopathic Board, Ministry of Health and Family Welfare, Government of Bangladesh. I am also the founder, chairman of Bangladesh Homeopathic Foundation, Bangladesh, and other social activities and professional activities in Bangladesh. Dear friends, first of all, I congratulate to all of you to this session on behalf of the community of homeopathy in Bangladesh, all doctors, students, teachers, and officers of our countries, those who are related to the homeopathy in Bangladesh, from all of them, congratulate to all of you. You know, the Bangladesh is a developing country. Now we are running to touch developed country under the leadership of our Honorable Prime Minister Sheikh Hasina and her Excellency Sheikh Hasina's uh, teams of workers, those who are in his cabinet, honorable ministers, honorable MPs, and others important persons who are related to the country's contribution. So let us come to the point. First of all, I want to introduce the homeopathy in Bangladesh. You know, the homeopathy in Bangladesh is an important sector in the medical science in our country. Bangladesh government is recognized homeopathy as a medical science, as alternative medical science under the Ministry of Health and Family Welfare. Bangladesh government and the founder of Bangladesh, our father of nation, Bangabandhu Sheikh Mujibur Rahman, who was first introduced homeopathy as a official sector in Bangladesh, official site on homeopathy under the Ministry of Health and Family Welfare 1972. Our father of nation thought homeopathy is the science by which we can deal all kinds of people and to reach our goal as a mankind by homeopathy. He thought that that is our father of nation, Bangabandhu Sheikh Mujibur Rahman, who introduced homeopathy officially in 1972. He found homeopathic board under the Ministry of Health and Family Welfare, the government of Bangladesh. Later, he donated for homeopathy from official site. Others dignitaries, those who are in homeopathic related person in Bangladesh, was involved in that time developed homeopathy in Bangladesh. It's a long history for the development of homeopathy in Bangladesh. Our government, under the leadership of Honorable Prime Minister Sheikh Hasina, who already introduced homeopathy in the health policy, national health policy and national drug policy, including the development policy of health sectors, all corners. Her Excellency Honorable Prime Minister thought that homeopathy need for all, for low cost means, effective means, and the no side effects. That means it's for simple low cost and availability in the country as well as world. Homeopathy accepted to the all. That's why our government very attentive to the development of the homeopathy in our country. You know, Bangladesh Homeopathic Board, under the leadership of our honorable leader and the chairman, Dr. Dilip Kumar Rai, Bangladesh, under the Ministry of Health and Family Welfare, we are working as a team of worker, Homeopathic Board, DG Health, DG Medical Education, DG Drug, and all associates of homeopaths. There are many associations, effective and effective. Those who are working in the field of development of the homeopathy in Bangladesh, like Shadinata Homeopathic Chikitsak Parishad, Homeopathic Medical Association, DSMS Doctors Association, Graduate Homeopathic Medical Graduate Association, Homeopathic Medical Officers Association, Homeopathic Foundation, Center for Advanced Studies in Homeopathy, Cash Bangladesh, International Organization Asian Homeopathic Medical League, Bangladesh Chapter, International Homeopathic Organization, Liga Medicorum Homeopathica Internationalis, under the leadership of Dr. Ashrafur Rahman, who is the national country vice president of Liga. Such types of associations, national and international, we are cordially supported for the development of homeopathy for the last 10, 12 years. And during this present government, under the leadership of Honorable Prime Minister, you know, we have a law for the development of homeopathy. Our law is the the Practitioners Ordinance 1983, the Homeopathic Practitioners Ordinance 1983. Another law is the Bangladesh Homeopathic Board Regulation 1985. Another law of our is the Private Homeopathic Medical College Establishment Rules 2004. We have also establishment rules 2011. Now we are amendment and correction our ordinance to the law according to the guidance of our government. Ordinance converted to the law as Act 2020. It is also finalized by the Ministry of Health and Family Welfare under the leadership of our Honorable Health Minister, Mr. Jahid Malik MP, His Excellency. It is also already finalized, and as per my knowledge, it is also sent to the Cabinet Division for the finalized to the Parliament meeting. So it is a great achievement for the homeopath in Bangladesh. There is a making a law for the development of homeopathy, where included homeopathic council, where included homeopathic research institute, where included for the higher education homeopathic university for the development of homeopathy. The research of homeopathy, we are planning to establish a research national research center. You know, the NIH in Kolkata and others countries, there is a research institute for the development of homeopathy. But Bangladesh, we have no research institute, we have no research unit, only a research unit in Government Homeopathic Medical College, which is not operating perfectly for the logistic support from the government. So that we are planning to establish a national research institute named Sheikh Hasina, Honorable Prime Minister's name, Sheikh Hasina National Homeopathic Research Institute. Already our government and the Ministry of Health and Family Welfare recommended this proposal, accepted this proposal to establish a research institute in Bangladesh. In another hand, we proposed in this act, which will be published very soon by the government, there is a council You know, the registration of the as a practitioners of homeopathy is very important. Another countries have council, like India. There is a National Research Council, National Homeopathy Council for the registration authority for the development of homeopathy. But Bangladesh government, like India, decided to establish a research and council, homeopathy council in Bangladesh. Already we have done this program. Government will start this project. Very soon, this council will run where the registration function and others developmental program will be done by this council. And this is very important for homeopathy in Bangladesh, that there is a diploma and degree registration. Till we are registration giving for diploma doctors in our country from Bangladesh Homeopathic Board. And degree holders, those who are BHMS from Dhaka University, they are enrolling as a registered homeopathic practitioner in DG Health under line director of homeopathy. There is two wings, but it is not good for our homeopathy. It is not the united sign of our homeopathy. So that we are thinking to build up a research, build up a council authority. Government and honorable ministers and honorable Secretary of Health and Family Welfare, our board chairmen, our members of homeopathic board, and others related persons are agreed to do this. So this is an important news for the development of homeopathy in Bangladesh. You know, another thing is we are included a proposal for the development of homeopathy to make a university, to establish a university of homeopathy in Bangladesh. You know, we are 2,000 above degree doctors and 40,000 above diploma doctors in homeopathy in Bangladesh, registered, unregistered, but DHMS or BHMS passed, not registered. I think the number of that is above 1 lakh. Those who are not practicing in homeopathy, but they are earned a certificate. They have already earned certificate, but not in practicing. They are also a huge number in Bangladesh. And quack homeopath, those who are familiarly engaged in homeopathic field, another 1 lakh persons. So for the development of homeopathy, higher education is very important. For diploma holders, they want to enjoy a higher degree like BHMS, degree registered practitioners, doctors, they are also interested to higher education like MPH, like MPhil, PhD, etc. For that reason, Bangladesh government and Bangladesh Homeopathic Board, with the consult with our stakeholders, we have decided to make a university like Bangabandhu Sheikh Mujibur Rahman Homeopathic University in Bangladesh. For that thing, we are input this point in our coming act for the development of homeopathy. So this is an important news also for our homeopathy. Another side, we are thinking make a hospital, modern equipped hospital managed by Bangladesh Homeopathic Board under the Ministry of Health and Family Welfare, financed by government. We are things to establish a homeopathic hospital. Last COVID-19, you know, all of you know very well, and successfully homeopaths are doing their activities in COVID-19 pandemic period. Our Bangladeshi homeopathic doctors, those who are living their profession in several districts, unions, Upazila level, urban and rural area, both sides, they are enjoying their practice during the COVID-19 time. But we have no achievement, official recognition. We have no documents. How can we treat the COVID patient? How can we treat our pandemic patient? For that reason, Bangladesh Homeopathic Board decided to establish a homeopathic hospital like Bangladesh Homeopathic Board Hospital, where all types of facilities will be engaged. Dear friends and colleagues, Bangladesh government under the leadership of our Honorable Prime Minister Sheikh Hasina and his cabinet members, parliament members, and Bangladesh Homeopathic Board under the leadership of our Honorable Chairman Dr. Dilip Kumar Rai, we are thinking for the development of homeopathy as others medical side like allopathy. Government already appointed about 120 homeopathic doctors as a medical officer in their hospitals, Jila and Upazila level hospitals, where 50 bedded hospital is also available homeopathic doctors. And government already taken a project like HPNSP. I repeat, HPNSP project. There is another 100 posts for the homeopath. Only BHMS, those who are passed from Dhaka University, graduated, they will be appointed in this post. Bangladesh Homeopathic Board and government Bangladesh Ministry of Health and Family Welfare already decided all these Upazila and Jela hospitals, including Union Health Complex, we are planning to appoint DSMS doctors as assistant medical officers. Those who are in engaged this homeopathic field, they will enjoy the service. So this is important that the development of the homeopathy in Bangladesh and our government planning all sides of facilities delivered to the homeopathic board and others like DG Health, DG Medical Education. Dear friends, those who are watching this program, on behalf of Bangladesh homeopathic doctors and teachers, students, I would like to visit Bangladesh after the pandemic period. And we also interested to arrange an international seminar like Liga under the leadership of Liga Medical and Homeopathic International Central Committee and our country national vice president. We are thinking and planning a well-established conference to show you. International organization, Liga Medica and Homeopathica will support us in this event. We hope cordially, we hope this session will be very effective for the all homeopaths. Regarding the COVID-19, you know, homeopathy is very important for the any kinds of pandemic disease like COVID, like SARS, like uh, yellow fever, like diarrhea. Recently, in COVID-19, Bangladesh homeopathic doctors, under the leadership of Bangladesh Homeopathic Board, we are we have already served 20 lakhs patients during this COVID-19 period. That is 20 million patients we have given homeopathic medicine officially. Unofficially, this number will be increases. Bangladesh Homeopathic Board sent to the doctors PPE for their safeguard, and all types of medicine and prescription advice is completely free during this time. This is important activities of Bangladesh Homeopathic Board under the leadership of our Honorable Chairman Dr. Dilip Kumar Rai. You know, the Bangladesh Homeopathic Board also opened 63 homeopathic hospital outdoor from 9 a.m. to 2 p.m. for the people outdoor service. Every homeopathic hospitals is open and doing their service. Government Homeopathic Medical College Hospital also separately served for the COVID patient their hospitals. But in our statistics, there's a huge number of patients during the COVID-19 period is collecting their medicine from homeopaths and uh, taking their advice how to save from COVID pandemic. So this is also important role for the homeopathic physician during this COVID period in our country. In another hands, our so many organizations like Cash Bangladesh, like Homeopathic Gobeshona Porishad, like Homeopathic Foundation, like homeopathic societies, many college persons was accumulated and uh, organized a free medical camping in this pandemic season for humanity. This is also an important role of homeopath for the homeopathic development in this period. You know, Bangladesh persons and Bangladesh doctors, patients, they all are living a low cost means, low cost life for the economical condition of Bangladesh. We cannot serve. What we have to do, what we have to done, we cannot do this for our logistics support. If our government and annual budget will be increases, we can do and we can be place our activities to the people, I think, very perfectly. Dear friends, anotherly, homeopathy education. You know, there are 63 homeopathic medical colleges, non-government but recognized homeopathic medical colleges in the country. approved by the Ministry of Health and Family Welfare, is operating their educational system, DHMS, Diploma in Homeopathic Medicine and Surgery course, which is 4 years academics and 6 months internship included. This is called diploma course in our country. On the other hand, we have BHMS degree course under the Dhaka University in Government Homeopathic Medical College and Bangladesh Homeopathic Medical College. The two courses is running. These two courses is running under two organization. One is the graduate Dhaka University and one diploma under Bangladesh Homeopathic Board is running in this country. For the students' development, for the educational development of homeopathy, we need huge budget. We need huge job opportunity so that the standard level of student, standard quality of students can come to this system. Those are engaged in this homeopathic system, they will see what is the benefit after the completion of this course. What is the future succeed after the completion of this DHMS or BHMS course. Regarding this point, I would like to say that all of our viewers, those who are engaged in official level, to input their own power, input request. I repeat, I request to input their all power, all facilities, all sides of support for the development of homeopathy, especially in the job opportunity. If we put a good tree, then we can collect a good fruits. And if we serve the tree and support the tree for the well-being, the tree will give us a good fruits. This is my personal experience. If homeopathic colleges engaged and deals with good students, good teachers, they will produce a good doctors. And good doctors will serve the good patient, the patient who will be a good health for the national health. So in this point, we have to think the huge budget and sufficient budget and short, middle, and long length planning for the development of homeopathy. Already we have working in this point. I think under the leadership of Honorable Prime Minister Her Excellency Sheikh Hasina, this government and our Bangladesh Homeopathic Board with the others associate supporters like organizations, like colleges, teachers and students and registered practitioners will go through we will go to achieve our result. Inshallah, in this point, national and international, local and abroad, I hope the support will be continued to the Bangladesh and the support will be continued for the development of homeopathy. I want to conclude my speech. I thanks the organizer, especially Dr. Ashrafur Rahman and others those who are related to in this event. and I cordially and from my heart I respect to the Honorable STF Honeyman, was the father of homeopathy. My salute to his soul. May Allah rest him in peace. Good night to every all and good health for the all of you. Enjoy a healthy and spiritual, peaceful life. Thank you. Thank you very much.
Thank you. Samina, madam. Samina.
Thank you, sir, for enlightening us by giving priceless speech. Now I am glad to introduce Professor Dr. Mohammad Ashrafur Rahman, is the President of Homeopathic Doctors Liga Bangladesh Society, and Dr. Rizal Rahman Homeopathic Foundation, National Vice President LMHI Bangladesh, founder member Tanjim Homeopathic Medical College and Hospital. He is also a Vice President Physician Unit, Bangladesh Human Rights Council. He is a great individual and stalwart in many of his professional life, and he has achieved great milestone in homeopathic sector. Dear sir, my humble question to that, what steps do you taken or will be take in future for Bangladesh homeopathies to flourish in both home and abroad? But this is my last session, so I am signing off the session and hope you all had a wonderful time listening from Bangladesh. I am thankful and indebted to all of you for giving me the opportunity to conduct the program. Thank you all. Please, sir.
Thank you, Dr. Samina
Thank
Arif.
you very much. Thank you very much. Bangladesh team nicely presented. All of you appeared very nicely and very nicely presented. Very organized manner. Thank you very much. Your coordinated activity. Very nice coordinators, especially the leader of the coordinator, Dr. Asrafur Rahman. Thank you for participation, and we will be grateful to you. We need further cooperation and unified efforts in bringing more heights for homeopathy for the welfare of humanity. Hope we will have more good times to come together in international arena. Thank you.